to Holly. I'm here today with my daughter Hillary, and she's going to help me complete the vital signs part of the physical assessment. First, we'll talk about the weight. I don't have one of the standing scales that you find in the doctor's office with a height and level, but I'll just demonstrate how we would use it if we had one. Okay, on one of those kind of scales, to calibrate it, you push both of the levers all the way down to the end so that it's on 0. And then at that time, I would have Hillary to take her shoes off and to step up on the scales. And then I would move the first level adjustment, and I believe it goes up to like 100. For her, that would be plenty, as she weighs about 98 pounds. But for someone that weighs over 100 pounds, we would move the second adjustment level on it, and then wherever the weight falls right in the middle, that would be their weight. To perform her height with one of those, I'd ask her to step off the scale so that I could take the height level adjustment and move it up. She'd step back on the scale, and I'd move that level down to her top of the crown of her head, and when I read that measurement, and that would be her height. At this part of the assessment, I'm going to have Hillary to sit in the chair, and we're going to go over the blood pressure part of the assessment. Okay. All right, Hillary. Okay, I'm going to ask Hillary to stick out her left arm, and I have a blood pressure cuff that I'm going to put on her. And I'm going to make sure all my arrows line up with her artery like they're supposed to. Alright. Got a little arm, but I still think this one will fit. Okay, here we go. And first, what I'll do before I actually start the blood pressure is I'll palpate for her radial pulse. And just relax your arm, Hillary. Keep it just nice and relaxed. And I feel it. And so what I'll do is I'll pump up the blood pressure cuff until I can no longer feel that. And I don't feel it. Once I get to 120, I don't feel it. So I'm going to slowly let the air out. Till I start feeling it again. Okay. Now I'm going to let her arm hang for about 30 seconds until I'm ready to actually do her blood pressure. So just kind of let your arm hang down, Hillary. Let the blood get back in there. And then we'll do the blood pressure. You can get all loose. Hillary wants to be a nurse, by the way, too. She's going to be 16 next week. So this is perfect priming for her. Alright, Hillary, I will replace the cuff on your arm, so just kind of hold it out there for me. Oopsie, sorry. Let's put this back on. And it's for me to be able to read your blood pressure. Alright, make sure my arrows are lined up with her artery. And then we'll put the cuff on nice and firmly. Alright, now if you'll just relax your arm, Hillary. I'm going to take her blood pressure at this time. And I'm only going to go up to about 120. got 106/66. Okay. Next, I'm going to take Hillary's temperature, and there's a variety of ways that we can take temperatures. I happen to have a digital thermometer, so we'll use that. The digital thermometer that I have here comes with little probes, disposable probes, so you can use one for each person's ear. I'm going to turn it on, and then what I'm going to do is just put this in Hillary's ear and press on the button, and we'll see what our results are. So, alright, Hillary, if you just lean over slightly, I'm going to put this in your ear, and I'm going to press the button, hold, and then it beeps, so we'll see what her temperature is. 99.4. Some would look at that as a low-grade fever. Okay, and to dispose of the disposable, you just, oops, push that, and it disposes of it. I'll let you dispose of your disposal. When Hillary returns, I still need to do her pulse and her respirations. There's several ways you can do a pulse. You can do an apical pulse by using your stethoscope and palpating the apical pulse, or you can also do your brachial or radial pulse. I'm just going to do her radial pulse, and I would do that by counting the beats for a full minute, and that's what I'll do right now. Okay, Hillary's pulse rate is 65. Now, the last thing that I would have to do in my vital sign assessment of Hillary would be to count and measure her respirations. What we're looking for in her respiration is just nice, easy breathing. We're looking for her nice, even chest rise and fall, easy inspiration and expiration. So Hillary just breathes normally, and I count her respirations for a moment too. With the pulse and the respirations, you can also count for 30 seconds and just multiply that by 2, as well as count for 15 seconds multiplied by 4. But I'm going to count for a full minute. So here we go with her respirations. For Hillary, you just breathe nice and easy and just try to pretend that no one is really paying attention to you. Okay, now that's over. I got 26, which is a little bit high, but when someone knows you're actually looking at them, sometimes that can kind of cause you to breathe faster. But 20, anywhere between like 16, maybe 24 is fairly normal. Well, this concludes the part of the vital signs assessment of the physical assessment. So thank you.